Welcome to Nurses Beyond Borders podcast series with your host Joshi. And today I'm delighted to introduce a guest whose career reflects resilience, lifelong learning and a deep passion for nursing. Joining me is Elvina, a nurse whose journey began with a Bachelor of Science in Nursing from Christian Medical College, Ludhiana, where she graduated with a prestigious Hall of Fame distinction. Starting her early career journey as an emergency nurse, Elvina took the role as a diabetes and hypertension nurse educator in New Delhi before making the leap to the United Kingdom in 2003. Since then, Elvina's career has been marked by both dedication and innovation. From being a nurse in the respiratory wards to her role as a non-invasive ventilation specialist nurse, she not only advanced her clinical expertise but became a passionate educator, teaching both nursing and medical staff the principles of non-invasive ventilation within the hospital setting. Her academic path is equally inspiring with postgraduate certificate in education, a master's in advanced practice, and non-medical prescribing qualification. Elvina went on to establish a brand new respiratory in-reach service at the Manchester Royal Infirmary and has served as the non-invasive ventilation lead nurse since 2013. But her story doesn't stop there. Since 2019, Elvina has also been leading rapid lung cancer services at Manchester Royal Infirmary and has shared her knowledge as an honorary lecturer at the University of Manchester and at the University of Salford. Elvina describes her journey from India to UK as both challenging yet charming. A testament to the blend of adaptability and the heart that defines her work. She learned, she taught, and through it all, she held fast to one simple truth. As she says, quote unquote, "I'm a nurse by heart and proud to be one." Stay with us as we explore Elvina's incredible story right here on Nurses Beyond Borders podcast. Welcome, Elvina.
Thank you, Joshi. Thank you so much. It's nice to be here, and thank you for a really nice introduction. Thanks.
Thanks. It's my pleasure to have you with me, Elvina. And as I remember, when I was new to the United Kingdom, you were one of my educators as well for my ASCII. So it's a proud moment for me as well to interview you. It is an incredible journey of yours, moving from Ludhiana to New Delhi and then to Manchester. So can you describe what made you to choose nursing? Why did you step into nursing?
Nursing, actually it goes back to my grandma. She was a gynecologist,
okay.
And at times she will take us to her clinic, and whenever I went with her I saw the nurses there, and I was so inspired by their really nice clean creased uniforms, and morely it was about the caring. I saw nurses as holding patients' hands and looking after them, making sure things are done for them on time. So that really inspired me. And I think I was in year 7 or year 8 at the time, and I knew I'm going to be a nurse.
Wow. So you didn't choose your grandma's path, but you chose similar path, which was in a different road.
I was the first nurse in my entire family,
Wow.
So after me, a lot of my younger sisters, cousins, they went on to be a nurse as well.
Yeah, so since you graduated and you worked as a nurse educator in New Delhi, what made you move to the United Kingdom then?
Now this is going to be a little bit, you may think, really this was the reason. So I act Florence Nightingale.
Wow.
That was my reason to come here.
Wow.
So, I was in Delhi working, as a nurse educator, was quite happy there. But I just wanted to know and go and work with the nurses in the land where Florence Nightingale was there.
Really?
So exactly.
How?
When I tell people think, really, that was the reason you came here? And purely that was the reason. I wanted to see how Florence taught. How Florence Nightingale taught her nurses, and what is the difference in, the nursing here and in India. And I do not regret my decision. I was quite happy, when I came here,
Yeah. Like many of us say that Florence is our inspiration, but then you taken a leap forward to explore her land. Wow. So as you moved into the UK, how was your journey and your settling? I know in 2003 it was the adaptation program for you. So what were the opportunities and challenges for you?
So when I was in India, I thought, it will be like Florence Nightingale time. We'll go and we'll be just, serving patients, and, you just go and just start looking after your patients. And like Florence was innovative nurse.
Yeah.
And I always believed in innovation. And I thought, I'll be doing, I'll be learning a lot of innovation when I'll come here. But when I came here, one, culture shock. Okay, which I was not very well prepared for. I knew there will be some changes, but I wasn't like, so well prepared for all that culture. So that was there. And then weather.
Yeah.
So I come from India, like really good hot weather there. And when I came here, I remember I used to start my shift when it used to be dark, and when I used to finish my shift, it used to be dark. So if I'm doing, day shifts, I wouldn't see sun much, and I missed my son from India.
Okay, yeah.
So I couldn't see sun, I used to start shift in the morning like 7 o'clock, and there was no sun, and I used to go out at like 3 or 4 o'clock, and there used to be no sun. And I typically came during the winter months. So I came here in December. Oh God, it was so cold.
Yeah.
But things have changed, and it has been nice. So those were certain things. And the transition, one thing that I thought was the biggest challenge was there were times when I felt a little bit isolated. Like, times when I knew that I have something to improve, right? But I don't know how to who to go to, where to, that was something. I think when I look back 20 years, I think a little bit isolated. I didn't know who to talk to, who to go to, and yeah. And one thing that I must say that, when I came here, I thought that, I'm feeling alienated, but and so I'm different, from others. But I'm sure the nurses who looked after me, or who took me under their care, like my ward manager at the time, she might have, come across some challenges for the way we spoke. Like I thought that, I couldn't understand the accent. It would be similar for her, she would be thinking that she couldn't get my accent. So, but it was, I think, two-way learning, and they were learning, the nurses over here were learning with us, and I was learning with them. So there were challenges, but there were a lot of celebrations as well. Each day, when you moved on, you passed a challenge, you had a celebration, you went home. It was a tiny celebration, but you had a celebration that, actually I had a good day, I could do what I wanted to do for my patients, or for my team, or for my colleagues. So, yeah.
Yeah, thanks for sharing that, Elvina. So, as you got used to the culture, the accent and everything, what motivated you to navigate further in the career path?
I always wanted to be a hands-on nurse.
Okay.
I always wanted to be with my patients. I wanted anything I was doing, I wanted to make it a better experience for my patients. So I moved on to be I was working in A&E, and then I moved on to be in a respiratory ward. And non-invasive ventilation was something that we started in 2007 in my hospital.
Okay.
And I just wanted it to be a better experience for my patient. As we know, it's a mask, tight-fitting mask, and patient usually feel uncomfortable. I just wanted to, I just wanted to know how, being a nurse, I can make it a better experience for my patient, how I can help my patient so that patient can be more compliant to it, and be more comfortable with the therapy, with the non-invasive ventilation therapy. So I started having keen interest in it. I started learning. I started reading research papers, what other hospitals have done, what were the new things they did, to help patients. And then when I got it, that didn't stop there.
Yeah.
Now I knew it. Now I want to tell my colleagues. So I started telling my nurses, my team members, do this, this is good. This is the way the machine will adapt to patients' synchronized breathing and all that. And slowly, everybody noticed that how I really wanted to help, I want to teach. And they said, why don't you take up this role to be the link nurse for that? And from that, I took up being a link nurse. I started educating nurses. Then it went on to teach the doctors, and then, the junior doctors. And then, I became the lead nurse for that, because then I was writing policies, I was writing transfers, so it was a nice thing, to...
So you had opportunities as well to explore
Absolutely.
further.
Absolutely. I did.
Yeah. So from, you mentioned that you wanted always to be with your patients. So what made you to move into the teaching or academia?
Exactly. So that's the reason I'm still, I'm in a lecturer practitioner role. I've not given up my, work at hospital, and I have had opportunities when, I've been asked, do you want to be a full-time in academia? And I just have a thing that, I think I have to be in practice to be, be here as to be teaching, because I think I can relate my experience on the practice when I'm putting it into theory, and then vice versa, theory into practice application. What brought me here, I think I just wanted to have a professional progression, to be honest, and actually in the beginning I wanted to learn myself. When I came here, I wanted to learn myself. I wanted to keep myself updated with the new nursing knowledge, with the new nursing teachings, with the new nursing doctrines. Every day there is so much to learn. When I was in practice, yes, I was improving on my practice a lot, but there was a lot of research, there was a lot of nursing work in education that was being done, and I think I was like behind with that. And coming here actually gave me an opportunity to get myself updated with this as well. And I must say, being in academia has actually helped me improve my practice.
Wow.
So yeah.
So in your journey, looking back, Elvina, what was the main challenge you would say?
In academia, or just altogether?
Yeah, altogether.
One thing was the isolation. When I started, I felt a little bit isolated. I think the other challenge that I must say was, I was very hesitant in trying new things. Although I wanted to learn all the time, but I was at the same time very hesitant to, try on the new theory or new practice that I have learned. And I used to be like 10 times, 20 times checking it. Is it this correct? Doing that. But now I think, I've grown slowly. I've grown as much as you kept, you do slowly, you take one step at a time. Now I think that, I can actually look at that challenge and think that I should have actually taken up, braver steps before. I could have done that, I think.
Yeah, it was my own. Never. So yeah, you've done it. So yeah, with your vast experience, having graduated from South Asia and then having your vast clinical experience here, and now teaching the future nurses, what do you bring into your role, and what is your role in decolonization of nursing education?
Nice question. I actually like this. I do, I'm a big fan of decolonization. Over the years, I've noticed, since I graduated in India, then I moved here, and I've been here in practice, in academia for a few years now. And the service users have changed.
Yes.
We've got diverse ethnic group now, and to make it a better experience, be it for our patients, be it for our learners, be it for my colleagues, I have to make it a better experience, a better environment, which is more inclusive, and it's more allowing more diverse practices. If I have to do that, I have to be promoting decolonization, making a space, a environment good for everyone. And for myself, what I bring in, I'm from India, so I bring in a lot of practices from India, be it nursing practice or any day-to-day, everyday practice. I can understand the beliefs that I have been brought and with which I grew up. I know that if I look after a patient who has similar belief, I can understand them better. And to understand them better, it actually creates an opportunity to develop a better trust from my patients or for my students or for my learners, and in that way it becomes a good two-way practice, where I am trying to be understanding of their culture, their belief, their practices, and in the same way they are trusting me that yes, their beliefs and their cultures are valued, their ideas are understood, their thinking are understood by others, and that's a better experience for both of us, for me as well as for our service user, be it my patients, be it my learners.
Yeah, that creates a sense of belonging, isn't it? When they see someone similar, when someone understands. Yeah, thanks, Elvina. So, what is one piece of advice you would give it for the future nurses or for your younger self?
So I tell, whenever we are in a difficult situation, so whenever, like say in my workplace or in university, whenever we are going through a difficult day, we all get challenging days. Not every day is a really nice hunky-dory day, where we have very good day. Every day there is a challenge of its own type, and I tell my colleagues or my junior ones, just pass this day and for the next time you will be a better nurse or you'll be a better tutor. So what I want to say is, if you have challenges, go with your time, take your time, do it, come out of it winning, and that for the next time you'll deal the situation better.
Yeah. We learn every time, isn't it?
Keep learning every day. That is the advice, I give it to myself as well. Keep learning every day. It's never too old to be a learner.
Thanks, Elvina. So we are going to ask you some rapid fire questions before we wind up. Yeah? Okay, so is it a coffee or a tea before a lecture session?
Coffee.
Okay. Are you an early bird or a night owl?
Always an early bird.
Wow. If you could teach anywhere in the world, where would it be?
Anywhere in the world?
Yeah.
Probably in a garden.
In a garden, any garden. Even at the backyard of your home. Wow.
Correct.
You love plants.
Trees, plants, greenery.
Flowers, wow.
If I'm allowed, I'll take my lectures in a garden, actually.
Wow. That's great. What's your go-to stress reliever after a long day?
Just reflection. Just myself on my couch, having a cup of tea or coffee and reflecting on it.
Thank you. So if you weren't a nurse or teaching nursing, what would you be doing now?
Definitely a cook.
A cook? You love cooking?
I love cooking.
What type of cooking?
Mostly Indian cooking.
Okay.
Mostly Indian cooking. But I do like a little bit of Indo-Chinese as well.
Okay. That's great. So I can come to your home then to taste the food. One thing you love about academia and one thing you would want to change?
One thing I love about academia is that, especially in University of Salford, I think we are very evidence-based, and I love that. That we like to rationalize what we are teaching. We just don't teach like that. It's evidence-based. That's what I love about it. One thing that I would like to change,
either in nursing or in teaching nursing.
Then I would like to strengthen the work power, the manpower actually.
Manpower, yeah.
Yeah, it's I think always working a little bit short-staffed.
Yeah.
So that's what I would like to improve.
Thanks, Elvina. Thanks. It was a great time having this conversation with you. Before we wind up, is there any one last thing you would want to share with our listeners?
Listeners, keep learning every day. Every day is a new opportunity. We all have challenges, but we all have a lot of celebrations as well. Joshi, I just want to say thank you to you. I remember you when I met you, when you arrived here, and same personality, same nice, you want to learn, you want to help others. The important thing is that you always want to help others, and that's what you're doing, and keep doing the good work.
Thank you, Elvina. I'm glad that you remember me, and it means a lot. Thank you. It was nice having you today, and wishing you all the best with the incredible work you do. Having a dual role as a lecturer and also as a lead in non-invasive ventilation. You're doing an incredible job taking care of patients and also preparing future nurses. And wishing you all the best. I look forward to hear more about your achievements, Elvina. Thank you. You're listening to Nurses Beyond Borders podcast series with your host, Joshi. Thanks for listening.
Thank you.